I am Dr. Malea Jensen. I am your host for Dr. J's Prescription for Health. Welcome, everyone. So what can happen here? I am available to answer your questions, medical questions, and hopefully get you to start thinking a little bit about your health, start getting you to think a little bit about why your doctor does what they do, and how you can be in a better partnership with your doctor. And I think that's important. I spend quite a bit of time with my patients when they come into the office. Of course, that has ended now, and all of my consultations are online. But when I did see them in the office, I spent time with them. And that's what it requires is time to spend with your physician. Now, with that being said, they might be limited. And so I think it's a very good idea that you bring questions in and be very prepared and lead them into the conversation so they can help you. Now, a lot of times that works and a lot of times it doesn't. So the most important thing is for you guys to be educated, and make educated decisions. But you cannot make educated decisions without enough information. So that's where I come in. I'm kind of waiting for everybody to get on here. But this morning, I thought that we would, let me make sure I don't have any questions here, just starting out. Good morning, Instagrammers. It's good to see you. I am live on Instagram and YouTube. So this past week, I did a couple of back-to-back reels in regards to carnivores and vegans. And I know there is a lot of in between, and I know there's a lot that falls outside of those two things. But I see that there is division naturally. Both sides are going to say that their side's right. Now, there were some questions that came up, or not even really questions, there were statements made. And so I want to just discuss this a little further. Good morning, Angel. Thank you for being here. I want to discuss it a little further. And I want to talk specifically about, good morning, Denver, I want to start up by talking about plants. And plants in general have defense mechanisms, just like an animal has a defense mechanism, okay? A defense mechanism an animal might have are claws or teeth, fangs, and they're fast. They can run from you, all right? They're defense mechanisms. They can play dead, like an opossum. Those are defense mechanisms to protect them from being injured. Now, what do plants have? You guessed it. They have defense chemicals. And some of those chemicals to be killed and eaten. So they're protective mechanisms. Some of those protective mechanisms that plants have are oxalates or phytates, saponins, tannins, lectins, fiber, goitrogens. They also have non-heme iron as opposed to heme iron. They also have sulforaphane. Now, many of you could say, well, that's a good thing, isn't it, Dr. Jensen? Isn't that an antioxidant? Yes, but it can also mess with phase 2 liver detoxification by increasing it. And you would think that's a good thing, detox, right? But what if you have medicines that you're supposed to be taking that go through the liver and now don't work as well because of the sulforaphane that is in the plants? One other thing, or a couple of other things to keep in mind when we consume plants or a plant-only diet, which gets the label of a vegan, vegans they eat plants, and plants have no B12. Do most vegans know this? Absolutely. Hi, Lucy. Lucy has joined over on YouTube. She is one of my Blue Shield moderators today. So if I'm, miss a question or she can help answer if I happen to miss it. Put a question mark in front of your questions and I can see them a lot easier. But I believe, let me see if I can pin that message that Lucy just sent. Yeah, I think I got it, Lucy. All right, I think I got it pinned to the top, that particular one. So plants lack B12, and most vegans know this, and they supplement with B12, right? Thumbs up with that. Plants also do not have carnitine, carnosine, creatine, choline, the C's. They don't have DHA, they don't have EPA, they don't have saturated fat, they don't have cholesterol. Sounds like a lot of don'ts, haves, right? But meat, on the other hand, contains vitamin D, B12, K2, vitamin A, EPA, DHA, creatine, choline, carnosine, carnitine, heme iron, taurine, zinc. Meat has those things. Now, plants do have ALA, and ALA can convert to DHA and EPA, which is our essential fatty acids, omega-3, but that conversion is very poor. It's less than 1% conversion. So most vegans get around that by taking something like flaxseed, chia, walnuts. They contain ALA in hopes that it will convert to DHA and EPA. Alga oil is probably their best form of EPA and DHA. Now, I want to specifically talk to you this morning about oxalates. Oxalates are not just a chemical, okay? Yes, they are a defense mechanism. It's one of the defense mechanisms that plants use. Oxalates are like crystals, okay? They are sharp, and when we chew the plant, especially if it's raw, we release or we fire these needles or these crystals into our mouth, and they can damage the cells in our mouth, our tongue, our throat. They're like spears being shot. Every time we take a bite and we crunch down, and that shearing fires off all of these crystals, these raphe. They're like sharp swords. You might not even realize it's happening, except when you eat spinach or kale or something like that, and you bite down and you get this like a coating on your teeth. That is the oxalates. That coating on your teeth that feels grittier, that it feels like running your fingernails across the chalkboard, those are oxalates. And those crystals are damaging to our soft tissue, okay? Some plants even have protease inhibitors, meaning protease is an enzyme that breaks down protein. But these protease inhibitors, so it's inhibiting the enzyme to break down protein. Those protease inhibitors can actually get into the wound that the crystal cut, and you can get in a what we would call an anaphylactic reaction. So your throat could close up, your mouth could close up. And now, is this common? No. But again, I'm sure that it has happened, and I'm just one who has not seen it frequently. Okay? Now, oxalates are actually made in our body. Our liver makes oxalates. If you were to look it up, you're going to get different values, but in general, you're going to get anywhere from 10 milligrams per day to 40 milligrams per day produced by the liver. And that is from breaking down glycine or hydroxyproline or glyoxylate, okay? So our body's making it. Our body will actually make even more if you're taking in high doses of vitamin C. Vitamin C. That can be a bad thing, okay? To us, oxalates are a waste, okay? But to a plant, they're another type of defense mechanism, as I've said. Now, if you can picture a plant growing in the soil, our soil is rich in calcium. So a plant makes oxalates for itself, not just as a defense for humans, but it makes it for itself. Why? Because there's so much calcium in the soil. Now, a plant needs calcium. It just doesn't need as much as it's likely getting. So it makes oxalates to bind to some of that calcium and, calm it down. And it will make a crystal. Again, these are those sharp raphe that get into our body. Plants also make vitamin C. So it's almost a double whammy, because if they produce vitamin C, they're making oxalates and more of them. So in all reality, if you're eating a plant and you are eating the plant for vitamin C and it has a lot of vitamin C, I'm guessing that that plant is also very high in oxalates. Now, when we have just a small increase of oxalates that go into our body, say our body is making about 12 milligrams per day, and we take in a bunch of vitamin C, we take in a bunch of plants with high oxalates, we risk increasing that oxalate level, and just a small increase of 4 milligrams can cause problems with our kidneys. So if you are looking at your labs and you are a relatively healthy person, you have no complaints, but you look at your BUN, your creatinine, and your GFR, estimated GFR, it's a little e, big G, big F, big R, estimated GFR, glomerular filtration rate. If that number is low, it should be 90 and above. The reference range will say 60 and above and you're good. You are not. What if it's 61? I mean, if it's greater than 60, it could be 90. It could be 91, but it could also be 61. So you want a lab that breaks it down and gives you an exact number. And a lot of times what you need to get is something called a cystatin C. Cystatin C, CYSTATIN, cystatin C. Cystatin C will give you a better indication, a more accurate glomerular filter, eGFR. It'll give a better kidney function, a better value for kidney function. Again, our goal is greater than 90. A person who is consuming a lot of oxalates, one, you increase risk of kidney stones, calcium oxalate stones. The calcium oxalate stones can get into the ureters, it can get into the renal pelvis, the kidney pelvis, and cause problems. It can decrease kidney function. Now, let's say, Doc, I really want to be a vegan. I really want to eat plants and I'm not going to change. What can I do? I'm glad you asked. One, take all the things that are low in a vegan diet. And you probably already know this if you're a vegan, okay? You want to supplement with B12 and carnitine and carnosine and choline and creatine and DHA and EPA. And, I don't know where you're going to get saturated fat and cholesterol, because animal fat and cholesterol is like us. But plant sterols are not like us. We don't use them the same. So that saturated fat is a problem. Now, with all those things being said, you're going to supplement with all of those things. you should cook or boil your plants. Do not eat them raw. Boil them for about 20 minutes. That will get rid of lots, if not all, of the oxalates. So boil for 20 minutes. You could consume calcium like a dairy product. Well, I guess you don't eat dairy. How about taking a calcium supplement at the same time as you're taking in the oxalates? That calcium supplement will bind to the oxalates, making calcium oxalate, and hope that our kidney can excrete them. All right? So these are just some of the things that you should know about oxalates. Now, some of you are eating dark chocolate and drinking black tea, eating chia and flax and quinoa and buckwheat and potatoes and peanut butter and almonds and almond milk and turmeric. And you're especially eating the turmeric with black pepper. Now, when it has black pepper, the turmeric actually has more oxalates, but you need the pepper to absorb the turmeric. So it's a crazy little catch-22. Now, remember that all root plants, they grow into the ground, under the soil, and they are sitting in a bunch of heavy metal too. So when you consume your heavy metals, your plants, you're not only getting a lot of oxalates, but you're getting a lot of heavy metals, okay? So the foods I mentioned, you could be eating on a regular basis, and they're high in oxalates. I mean, and we never really hear of these things. Although I have seen, now looking back, multiple patients who came in with symptoms that I think are probably oxalate toxicity. One person, he was obvious, and I figured right away. His wife started making him plant smoothies. He was drinking, and part of it was to lose weight. They were doing this together. And part of it was to get rid of all animal products. So he was consuming 5-6 smoothies a day. It got to the point where he actually couldn't get out of bed. He couldn't make it to the bathroom. He was weak. He was fatigued. He had trouble breathing. He thought he was dying, to be perfectly honest. And I caught it right away. I only saw this individual once because he said, "How am I going to tell my wife?" And I said, I don't know the script you're going to use, but I believe you're sick. And I did get kidney function, liver function, all of that. And, I don't ever know what happened to that patient, but that is a scenario. Another one I want to bring up is hiccups. Now, hiccups, those are just normal hiccups. Well, what if you just got done eating a spinach salad and you had some almonds on it, and then you had a little bit of dark chocolate for dessert along with a cup of black tea, and on your salad you had some chia and some flax, and you might have washed it down with a little bit of almond milk. I mean, who knows, okay? Let's just say that you had that meal, and you maybe within a day or that same day, you started getting the hiccups. You didn't think anything of it. Why? Well, that tells me that your vagus nerve is being hyperstimulated. And you see these calcium oxalate crystals can form on that vagus nerve. Crazy, right? Just looking at hiccups. Another thing, and if you were to ever read the book called Toxic Superfoods by Sally Norton, she gave a case study, and I will never forget it, that this individual went out to eat with his family. I believe it was his family. It's been a while since I read the book. And he went out and he had some sorrel soup. Sorrel, S-O-R-R-E-L, I think is how you spell it. Had sorrel soup. And he ended up having a heart attack and he died. When we consume high doses of oxalates, it's going to steal the calcium because the body knows that the oxalates are poisonous. And so it will steal as much calcium as it possibly can in the moment to make calcium oxalate and basically neutralize the oxalates. And you'd say, that's a great thing. Unless, of course, the heart really needs calcium in order for a normal rhythm to propagate. So if you steal all of the calcium from where the heart needs it, you can stimulate a heart attack just by consuming oxalates in high doses during one meal. I mean, this is crazy stuff, right? I mean, do people who consume all of these plants know these things? And that's why I'm just trying to bring this to an awareness for people. Even if you were aware of all of the things, the bad things about oxalates, okay? And you say, Doc, I'm going to stop eating oxalates. I would suggest to you that you go very slow. Your body is used to taking in 100 milligrams of oxalates a day, maybe upwards to 200 milligrams, and not had a symptom yet, okay? And you are one that should not go cold turkey. When we have so much oxalate in our body, it gets embedded in our tissues, our lung, our heart, our brain. And so your body is actually used to a constant supply of oxalates, okay? And it takes them out of the bloodstream and steals your calcium from your bones, from all over in your bloodstream, and it makes a calcium oxalate, and then it gets stored in tissue. When your oxalates suddenly drop in our bloodstream, the body senses it as a relief. Whew. Okay? It feels relieved that you've stopped the oxalates, and it doesn't have to work so hard to bind all of them, to neutralize them and make calcium oxalate. So if the body was used to all these oxalates in the bloodstream and then it's not there, the tissues will release all of the oxalates in your body. All of the tissues will start dumping their oxalates into the blood, knowing it's now safe to get rid of some. And you could get into a state of depression, seizures, tremors, your eyelid twitching. It could feel like the flu. You could get joint aches and pains. You could develop all these kidney stones. So there is a pathway that I've been describing right now, okay? The pathway that I'm describing is the 5 S's. And it starts with the plant in the ground, and we consume it. The first S is a stab. The crystals stab our mouth, our cells in our mouth, or our tongue, our throat, and all the way down. Stab. Then surge. The blood becomes saturated with oxalates. And these oxalates now destroy the red blood cells. When they destroy the red blood cells carry heme, they carry iron, they carry oxygen. So now you're consuming something that is destroying the very things that make your body go have a 1-2 punch. You need your red blood cells, okay? So that's the second S out of the 5. There's stab, then surge of high oxalates in the blood, then stuck. And that's what I mentioned. They get stuck in the organs. These crystals, calcium oxalate, get stuck in the lungs and the brain and the heart and our joints. They get stuck. That's the third. Then stress. That's the 4th S. The 4th S is the liver becoming overwhelmed with oxalates. And if these oxalates are bound up in the liver. Oxalates lead to oxidative stress. And oxidative stress, you guys, is tough on you. And so you rely on antioxidants. Now, where in the body is your master antioxidant being formed? Good question, right? You can likely know where I'm going with this. It's formed in the liver. So if the liver is choked up with all of the oxalates in your body, okay, can it take the time to be making glutathione, which you need because you're in oxidative stress? Okay, likely not. So now your master antioxidant is working halfway, not even maybe. We don't know. So this over time, it might not be immediate, like the guy who ate the sorrel soup. Might not be right away. But over time, they do build up. And have oxalates been correlated with Parkinson's disease, cognitive decline, and Alzheimer's disease, heart attacks from the buildup of calcium? You know, calcium in your arteries, calcium oxalate. It's a possibility, you guys. So I'm not telling you not to eat your plants. I'm just giving you information so you know not to maybe overindulge. There's a lot to be said about a very restricted diet. And honestly, a vegan diet is one that leaves a person malnourished unless they are supplementing. A person who's on a carnivore diet, for the most part, you could thrive and survive simply by eating animals. Now, I would suggest, because of what I mentioned over this past week, for a carnivore diet, if you're going to do this, you don't simply restrict yourself to the muscle meat, because now you can be in problems, have problems. Okay? And we can go into that. But there's a very fine line between these restrictive diets. A vegan diet absolutely you cannot survive if you did not supplement. There's no B6, there's no B12, there's no essential amino acids. You can try to mix and match, but it's going to take a lot of the plants in order to make what you need. And now you risk other things because you have to consume much, much more just to get what you need. Now, on the flip side to the carnivores out there, if you are eating nose to tail, you will likely be fine. But when we limit ourselves to just eating muscle meat, now you're not so fine. Now, again, you might not have a problem, ever. But your study of just you does not encompass the whole population who's eating carnivore. And many can have problems. And so we have to take into consideration all of these things, okay? I thought estimated GFR was antiquated as a means to determine definitive kidney function. Aren't they using primarily creatinine to BUN, or BUN to creatinine ratio, and overall levels to determine acute kidney injury, or in this case, CKD? The estimated GFR that is on your complete metabolic profile does not take into consideration muscle mass, age, gender, and a whole bunch of other things that can throw off the estimated GFR on your chem profile, the CMP, the complete metabolic profile. If you get a cystatin C, it's more accurate. If you get a microalbumin, a urine microalbumin, that together is even better. know about your kidney function, okay? I have had several people that come to me and they say, Doc, my kidney function's fine. I said, what's your GFR? It's 60. It's right where it should be, 60 and above. I said 60 is already chronic kidney disease stage 2. You already have you already have CKD stage 2. And then that puts them over the edge. Well, how come my doctor didn't tell me? Maybe your doctor didn't know. I don't know. But you could look up the stages of CKD. Just Google, what are the stages of CKD? And it will give you the numbers, the ranges of your GFR, and you'll see what stage you're in. Okay? You should be over 90 for an estimated GFR. So yes, WP, hopefully that answered your question. Raccoon, is it flow rate measurement? Sorry, I don't understand your question. Yep. Thank you, Lucy. Thank you very, very much. I appreciate that. Right. Lucy says, with a soup with that name, yikes, I would probably never eat. Again, I had never really heard of it, to be honest. I didn't realize. I mean, that whole book, if you really want to read, it's called Toxic Superfoods, and it's Sally Norton. And I believe I read it. I know I read it well over a year ago. I would probably need to read it again. Maybe just read my underlining and my notes. Gluten says, crazy stuff. What's the best form of calcium supplement to take? Calcium pyruvate? Well, what is the best calcium supplement to take for what? Are you referring to if I want to get rid of oxalates? If you're thinking, my gosh, I need to consume some calcium because I want to eat some oxalates today, calcium citrate, any citrate will help bind oxalates, okay? I mean, calcium citrate is probably the best. Magnesium citrate will. I believe potassium citrate will. So those are the things that can bind excess oxalate. But you might want to consider, hey, maybe I'm one of those people that goes out for soup and I have a heart attack and die. You don't know how you tolerate oxalates until, it might be too late. There was you guys have heard me talk about this before. I probably 2 years ago, I think it was 2 years ago, I watched a lecture series with Dr. Anthony Chaffee, Chaffee. I'm sure many of you have heard of him who are listening right now. But he did a lecture series on plants are trying to kill you. And after watching that lecture series, I didn't eat another plant. Now, I have gone out to eat 3 or 4 times, maybe 3 times in the last 2 years where I consumed plants. I had a huge salad bar and all of the things that I probably mentioned, the chia and the flax and I had even had some potatoes. I peppered my whatever I ate. I might have thrown some nuts on my salad. Could you imagine the oxalate toxicity after not eating any? And I ate all of these oxalates. I mean, I could have easily used up all of my calcium in my bloodstream, took it away from my heart and had a heart attack in order for my body to absorb the amount of oxalates that I consumed, and it used up all my calcium to bind to it. I mean, it's crazy thought. It's crazy thought. I'm so glad I don't work in the ER. Okay. Good job, Uncle Charlie. Cold plunge it away. Cold plunging. Uncle Charlie says, OMAD, 1 pound grass-fed beef, 6 eggs, 6 egg yolk, 4 whole eggs. So total of 10 used eggs. Okay. OIOI. What do you recommend for kidney problems? I don't know what your kidney problems are, so be a little more forthcoming. Okay. I see your question, OIO. I don't know what kidney problems you have, so please be more specific and I can try to help. Okay? All right. Any questions? Yeah, I understand just, stage 4, but I don't know why you have stage 4. What caused your chronic kidney disease stage 4? Was it out of control blood pressure? Was it out of control diabetes? Was it oxalate toxicity? Do you have kidney stones? I don't know what your concern is. Again, as a reminder, you guys, this is for information purposes only. I am not your doctor. You're not my patient. I am a doctor. You are a patient, but you're not my patient. Okay? I'm family practice. I've been in practice for 27 years. A lot of this stuff was not taught to me the first 20 of my 27 years. It wasn't taught to me, and I had to go out and do my own reading. I'm not sure that a lot of other doctors are doing that, okay? And that's one of the reasons why you feel a lackluster when you go see your doctor, because they're not giving you the things that you need to know, because 1, they might not know it. 2, they don't have time. And 3, you know what? It would just take too much of their energy. I don't know. I don't know the answer. I could tell you that it was probably, for me, a lack of knowledge. Did I take the time? Probably not. I was seeing 40 patients a day. I was working after hours, and I didn't even have enough time in the day to do some extra reading. And the reading I did do was the required reading for CME, continuing medical education. And the continuing medical education is the exact same education profile that we got when we were in medical school. So you can imagine that it was pretty much with your blinders on. It was narrow-minded, and you were fed whatever the curriculum was written by, whether it be pharma or big food or both, which is the same, okay? So again, our education was very limited when it came to looking at oxalates, looking at dietary things, looking at your protein, looking at someone who's just eating muscle meat and maybe isn't getting enough glycine, which is another amino acid. Remember, we have essential amino acids that need to be obtained from our diet. And then we have non-essential amino acids that our body can make. Glycine is actually considered a non-essential amino acid, but I will tell you right now that it's conditionally essential. And I talked about that this past week. If a carnivore is only consuming muscle meat, they are consuming a ton of methionine. Red muscle meat is full of methionine. We need some methionine, an amino acid. It's needed, okay? But in the amount that we might be consuming it is a negative. In order to neutralize the methionine that we're taking in high doses, we need glycine. So if we're using up all of our glycine to neutralize the methionine, what happens to glutathione? Why do I ask? Because glutathione, the 3 things that it needs to make glutathione is glycine, cysteine, and glutamic acid. So if you're using up all the glycine to neutralize all the methionine, then what happens to the glutathione? It can't be produced as well. Glycine is also needed for our immune system. It helps with stress. It helps with managing blood sugar. In fact, diabetics and people who are obese actually make less glycine than somebody who doesn't have obesity and diabetes. There is a lot to take into consideration, you guys. And simply just supplementing here and there is not in our best interest. Now, to solve the carnivore problem, you could boil the bones and drink the bone broth. You can nibble on the bones. You can eat the collagen. Those are all rich in glycine. Glycine is actually in the animals. You're just not eating it. Just eat the whole animal. Eat the organs and drink the blood and all of the things, okay? Don't let it go to waste. OIO, I'm asking if she, me, knows how to fix the kidney, not fix what is causing it. Okay, I think OIO needs to, see your doctor, and they will fix your kidney, okay? That's the thing. But if you don't want to take into consideration that you could reverse your kidney disease by removing what is causing it, then I think you've missed the boat, okay? And I guess yes is agreeing with me. Well, to fix the kidney, you have to treat the underlying problem. Very good point. That's a very, very good point. Miss Young, what was your question in regards to cheese and milk? Is that regard to if you're going to eat these oxalates, if you ate some cheese with it, will that help? Yes. Milk, yes. Any dairy. Butter can help. As long as it's got calcium in it, it will help neutralize some of the oxalates. Good question. If that hopefully that was your question, I'm not sure. Okay. Miss Young says, did you work out after and notice how sore you were? No. I mean, yes, I probably worked out, but I probably at that time did not correlate me eating the oxalates and the joint aches and pains. I probably did not even think about it. I do recall, I mean, everybody probably recalls this, is if they're eating, salads and there's spinach and there's all kinds of arugula or, whatever is in the salads, your teeth feel like they got this coating all over them. And yeah, that's oxalates. Cloudy urine, oxalates. Like I said, hiccups, cognitive decline, memory problems. That can be oxalates, you guys. LOL, my kidneys are perfect. Okay, I guess then I misunderstood you. I thought you said if you have chronic kidney disease, stage 3. So if your kidneys are perfect, then I don't know why you have kidney disease stage 3. And I can get rid of what causes it. You can fix the kidney unto itself. I'm sorry. I don't understand your question, if that is a question. RM, you need to fix the root cause, not the problem. Otherwise, you're just band-aiding the symptoms. Yep, good point. Music Man, the bubbles in the urine, that could be oxalates, okay? Some people get foamy urine, some people get cloudy urine, and you might want to monitor whether or not, that is after eating oxalates. I mean, you could have had a handful of almonds. You could have eaten, simply 2 tablespoons of peanut butter could have put you over. What about an ounce of dark chocolate? The darker that it is, the more oxalates. So milk chocolate would actually be safer form of chocolate as far as oxalates are concerned. What if you drank some almond milk or had a little bit of turmeric with some black pepper and then ate some spinach? Yeah, all of those things could be oxalates dumping in your urine and you're noticing them. Urinating at night, it could be, I know if you listen to Dr. Bickman, he would tell you that, if you're urinating at night, it's because your insulin is very high. So you likely ate a high carb diet and rose your insulin. And then, one of the token abnormalities is getting up in the middle of the night to urinate. because of high insulin levels. That and being hot at night, your heart racing, anxious, I mean, all of these things. But I would also add to that, urinating in the middle of the night would be high oxalates in your urine. Okay. 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 Yeah. Yes, the foamy urine. Okay, I just answered that. Okay. Thank you, Bubba. I appreciate that. Oh, here's a question in regards to the carnivore diet and eating muscle, eating, I'm guessing, only eating muscle meat. Should you take a glycine supplement? I suppose that, I mean, if you're not going to eat nose to tail, then maybe supplementing with a glycine supplement would be in your best interest. How much do you need? I guess it would depend on how much muscle meat you're eating. If you're a stressed person, you're not sleeping well, I would venture to guess you probably need more glycine than somebody who's not stressed and who sleeps very well. If you are a person who gets sick easily, you're probably going to need more glycine. How much glycine? Again, that is a good question. There have been studies upwards to 10 to 12 grams per day. Our body makes about, I believe it's 2 grams per day. And you could see how that would get used up very quickly, especially if you're eating a lot of muscle meat. So you could get a supplement. You could take a glycine powder. You could take glycine in capsule, like pure encapsulation. Now, remember, a dose might only, their serving size that they're giving might only be 1 or 2 grams. And if you need to get 10 grams per day, it's going to take a lot of capsules, and that's a lot of money. There is I cannot remember his name. I think it's Dr. Brind, B-R-I-N-D. He makes his own product of glycine, and it has some other amino acids in it. And I've actually done a little bit of research this past week in regards to it. It's called Sweetamine. So Sweetamine, Sweetamine. And basically you just drink 1 packet a day. And 1 packet a day has enough glycine, about 8 grams, that would probably suffice, plus what your body makes, plus what you might be getting in your diet, okay? So that might help. So Sweetamine, I do not work for them. I am not getting any credit by them. So yeah, glycine. And Bubblicious, if you're talking about the glycine and tumors, there has been some recent, well, and I wouldn't even say recent, I think there's been some recent meta-analysis, but the original studies were done a long time ago, and it was on increasing glycine to starve out cancers. Imagine that. So yeah, there's some, and you probably have to do a good PubMed search on glycine and tumor or cancer treatment. Glycine and cancer treatment. I don't know. I have not had a time to. Gluten says not to be an alarmist, but get checked out by a doctor with foamy urine, as it can be an early sign of kidney cancer. Yeah, I would agree. We miss a lot of these early stages because we feel good, and we do miss a lot of things. Yeah, get it checked out. Get a urine culture and sensitivity. You can check your urine for oxalates. It just needs to be sent in. It's not something that your doctor can do in the office, okay? So, all right. Okay. You guys you're just letting me talk. There's no questions. That's surprising. All right, let's talk about vitamin D. I had a couple of plans. Usually you guys are more forthright with all of your questions, but luckily I planned ahead. Let's talk about vitamin D. Should you supplement or should you not supplement? That's the question. A question that you should ask yourself. So like we're going to put on our thinking caps right now. Why is it that if you're in America, or really anybody, but let's just say you're American, and your doctor is looking at your lipid panel, and your doctor says, gosh, Jimmy, your cholesterol is really high, and I think we should treat it. And you say, okay, but you scan down your labs and you say, Doc, why is my vitamin D level so low? I take vitamin D. I'm outside in the sun all the time. Why is my vitamin D so low? And when I hear people ask me that question, I start to think to myself, doesn't high cholesterol or doesn't cholesterol make vitamin D, the hormone vitamin D, which we call a vitamin, but it's a hormone? So shouldn't our D be extremely high if our cholesterol is extremely high? I mean, doesn't that sound logical that you should have enough vitamin D because you have enough cholesterol? And why is it that you keep taking vitamin D and nothing is helping? One, and this is a very big one, when we check vitamin D levels, we are checking as doctors, I'm talking we as in doctors check stored vitamin D. We check stored vitamin D levels. And the levels go anywhere from, I think, 20 to 100. And you've likely been told that if it was over 60, you should be fine. 60 and above. But what if you can't get it even above 50? And you're going, I have all this cholesterol. Why isn't it converting to vitamin D? So you take a bunch of vitamin D and it still doesn't help. What could be happening? I'm going to give you a scenario. A person who is taking supplemental vitamin D, what are you doing to your vitamin A level? If you're taking in large doses of vitamin D, what happens to your vitamin A? Does it go up or go down? And the answer is, it goes down. If vitamin A goes down, what happens to copper? Does the copper level go up or go down? Answer it in your head. If vitamin A goes down, what happens to copper? Up or down? And the answer is, it goes down. If your vitamin D is elevated and your vitamin A level is low and your copper level is now low, what happens to iron? Does it go up or go down? Answer it in your head. The answer is iron in the blood will go down, because when copper is low copper will drive iron into the liver, and it will get trapped there. And there's a certain transport protein that helps to transport iron inside the tissue of the liver to the outside into the bloodstream, and that transport vehicle is broken because copper is low. When copper is low, hepcidin blocks the ferroportin, the transporter, to get the iron from the inside to the bloodstream. So everybody out there who's taking a bunch of vitamin D doesn't know what they're doing downstream. If the liver is if the liver is trapped or has a bunch of trapped iron inside, you're getting oxidation going on. Iron oxidizing is rust. So your liver is rusting inside. And then let's just say you're eating a bunch of oxalates. I mean, let's really topple over the liver. This is why I tell people to get not only a stored vitamin D level, but get an active vitamin D level, a calcitriol level. Your stored to active vitamin D should be 2-to-1. Your active vitamin D should be 2 times your stored. That calcitriol level should be 2 times your 25 hydroxy, 125 hydroxy vitamin D, stored vitamin D. You can look it up. They're long equations. So you can look up stored vitamin D equation and active vitamin D equation, okay? One is 125, I believe, dihydro vitamin D. You can look that up, but there is a stored form and an active form, and you should have more active form than stored. Even if you checked your stored form, not all stored vitamin D is activated. So if you are consuming all of this vitamin D, you're not converting it to active vitamin D. You lower your vitamin A, which lowers your copper, which drives iron into the liver. Now you're getting oxidation, rusting inside the liver. Glutathione can't be produced because, again, you need glycine, and you could be low on glycine because you're eating a bunch of muscle meat. If you're not eating muscle meat and you're eating vegan, then you're getting the oxalates, and the oxalates are taking over the liver. And you can see where we're having a lot of downstream problems just by thinking we're doing something okay by taking some vitamin D or eating some plants that they told us to eat. All right? I agree, Lucy. Investigating the root cause is very important in anything. You know, instead of just accepting that the doctor goes, oh, here's your diagnosis, here's your pill. Instead of just doing that, just look into it further. Say, you know what? I appreciate that recommendation. I'm going to go home and I'm going to study this for a couple weeks, and then I'm going to come back and make another appointment. We're going to discuss it. I think that's a great thing to do. Okay. Hardgrove Caroline, I posted a couple of questions, okay? I didn't get them. Help me out. I don't do live video requests, but there's also a little question mark that you could put, and I get notified if there is a question. It's a little bubble question mark. So Hardgrove, let me know what your question is. I'll try to answer it. Let's see. RM says, can you order the urine culture and sensitivity test for us without a cost? No, I cannot. I can order labs, but your insurance will not pay for them. And I'm pretty sure I can order urine culture and sensitivities, but it would require that we do not necessarily. If there are people out there who their doctor will not order their labs, I can order your labs. I'm not going to charge you if you want me to order your labs. If you want me to go over them, then I will ask you to schedule a consult and we'll go over them. Okay? And if you want to schedule a consult, just email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. And we can go over your labs. That's one of my favorite things to do. We can talk about your labs. We can talk about your diet, your exercise, your sleep. We can talk about your medical conditions, all of your medications, everything. We can schedule an hour, or we can keep talking until, until you're satisfied with if your questions are answered, okay? Hardgrove, I requested to join a video. Again, yeah, I don't do that. I think that's why you can't see the questions. Just repeat them and I'll try to see them. Go lay down. Now I got Tootsie talking. She did not want to go to the bathroom when we all went out to go to the bathroom. She wanted to stay inside. And now she's going to be a naughty little girl. Okay. Julia says, hey doc, can you shed any insights on high parathyroidism? So that is up there in your brain, your parathyroid, and you have, I'm guessing, a high PTH. So you got an intact PTH, parathyroid hormone level. Is that what happened? Did you get an MRI of your brain? Let me know. I'm guessing that you had a very high calcium level. It likely was over 10. Hardgrove says, I have a client that is prone to uric acid stones and low urine pH. Urologist suggesting a low protein diet, but I don't agree. Would love your take. Okay. No, leave him alone. Go lay down. Okay. I don't know what, Hardgrove, I don't know what your client consumes, but if they are consuming a lot of muscle meat, so let's just say they're carnivore. Let's just say a majority of their diet is muscle meat. That muscle meat, which will suck because it has methionine and a lot of it, it will suck out your glycine. And guess what? You need glycine to help the kidneys excrete uric acid. The kidneys need glycine to excrete uric acid. Now, a person who has uric acid that's building up either is making too much, consuming too much, or not getting rid of it. If your person is consuming a lot of muscle meats, which is high in methionine, using up all the glycine, now the kidneys don't have glycine in order to neutralize that uric acid. That uric acid builds up. That person is not just at risk of uric acid stones, they're at risk of cardiovascular. They're at risk for heart attacks and strokes. And that person is also at risk for congestive heart failure and AFib. Uric acid is nothing to mess around with. Just telling them to eat low protein. And it's not just low protein. They're actually telling them to eat low animals because they're saying that because of the purines that they're consuming in meat, which is purines are in other things too, that purine is breaking down eventually into uric acid, and that is their cause. But if they had enough glycine of normal, our bodies are very good at taking care of things. But yet if we overconsume something and underconsume something else, you can see where this person would have a low glycine levels. They could have low glycine levels. And that glycine now isn't available for the kidneys to help excrete that uric acid. So it builds up. And then, like I said, your client is getting uric acid stones. So Hardgrove, you want to, and I don't know if you can do this or not. They're a client of yours, but I don't know what you do. Are you able to talk about their nutrition legally? Maybe it's just a friend and then you can, right? Say, hey, what are you eating? Are you eating things that are high in purines? Because just simply eating a low protein diet, now why are they going to be a client of yours? Because they're not going to have any muscle mass. Their bone strength, they're going to be at risk for fractures. So telling somebody to eat low protein I would think that's malpractice too. I guess I don't understand where they would get that answer. Okay. Hardgrove also asks, how do carnivores get vitamin C without supplementation? They don't need supplementation. They have enough of vitamin C the reason why vitamin C is needed is because vitamin C and glucose use the same receptor. If a person is eating high carb diet, that glucose blocks the receptors for vitamin C. They look almost exactly the same. They use the same receptor. So a person who's eating high carb diet is going to need more vitamin C to saturate those receptors to get the glucose off the cell membranes, off the receptor. If a person is eating carnivore, the 15 milligrams that their body has and makes inside their body and gets through the meat, you know what? They got enough. I have never seen a carnivore that was low in vitamin C and had repercussions, like a disease. So yes, they are getting enough vitamin C. Here's another thing that I'm so glad you brought this up, Hardgrove. Guess what high doses of vitamin C do to vitamin A? Lowers it. And the low vitamin A does to copper? Lowers it. And the low copper does to what iron? Drives it into the liver. That person who's trying to increase their antioxidants because they were told that they're not going to get sick if they take high vitamin D doses are actually lowering their glutathione production in their liver. And that's an antioxidant, the master antioxidant. So when we go and take all these vitamins, you guys, thinking that they're doing something for us, you got to remember that anything we consume is affecting everything downstream. Normal biologic and physiologic processes that go in our body, going on in our body. It's blocking it or disturbing it or changing it. Let me give you an example, and this one everybody can relate to because it's very common. When we take cholesterol, the pathway to make cholesterol, our liver makes cholesterol, right? It makes it through the mevalonate pathway. The mevalonate pathway. If we take a statin, an HMG-CoA reductase inhibitor, we are inhibiting HMG-CoA reductase, the enzyme that breaks down HMG. So if we have HMG-CoA, we need an enzyme called HMG-CoA reductase, reducing it, in order to make vitamin D, make vitamin K, make CoQ10, make cholesterol. That's what a statin does, is it blocks that. So if I take in something, I'm blocking normal biologic and physiologic processes going on in our body. Now, you could say, but I've done it for 30 years and I don't have any problems. Great. I mean, you could be the one that doesn't have any problems. You could take 5,000 milligrams of vitamin C and change up, the whole antioxidant pathway, with vitamin C and vitamin E and NAD plus and all of these things. You could be the one that doesn't have a problem. Or you could be the one that has a whole bunch of problems. And what if all of your problems look like something totally different and your doctor goes, you know what? That's just normal aging. Yeah, everybody's liver goes bad when, it ages too. And so you never even thought that your high doses of vitamin C is a problem. You never know that because during a certain viral infection going around, they tell you to increase your vitamin D, increase your vitamin C, increase your zinc, all of those, this little triad here, all of those decrease vitamin A, decrease copper, and push iron into the organs, like the liver. And now you're getting oxidative stress. And then you'd need all of your antioxidants to fight the very thing that's going on that you were doing yourself. You're taking D and zinc and C in high doses, and those lowered A and those lowered copper, and then copper drove the iron into the tissue where the master antioxidants are used. And so you might have temporarily helped yourself, but in the long run, you're not. But I just don't think, and I'm speaking for myself, unless you study this stuff, doctors aren't going to know. They don't know. They'll list, you go into the doctor and they say, hey, do you take any medicines? No, I don't take any medicines. Well, do you take any supplements? And they just go and they document them. That's it. They just document them. Well, if the doctor documented them and they noticed you're taking 5,000 of C and 10,000 of D and 50 of zinc, and they never mentioned you about liver stress? I mean, shouldn't we know all that? All they could have done is document and say, I do not recommend they take C, D, and zinc. They could have just documented it. But you can ask for your chart, see if they documented it. Bible Thumper, I do not know Dr. Rex Newham. Can kidney disease be reversed? Yes, depending on how far along you are. Squazzly, you can, but I might not know the answer to Graves' disease. But shoot, and I'll, ask your question. I'll try to, do the best. If I don't know, I won't. I'm not gonna, I will try. I'll try my best. So go ahead and ask. Miss Young says, Hardgrove, carnivores don't require much vitamin C due to not eating high carbs. Oh, okay. So you guys already answered this. Hardgrove says, I'm a nutritionist. She is not a carnivore. I want to order an oat on her too. Yeah, I mean, all the extra tests are very high. They could be a financial burden, and you just need to be careful. And again, you have to know how to interpret it. Once you start ordering these tests, you have to know how to interpret it. And that can be the bugaboo right there. Okay. Yeah, 6 years of chronic kidney disease, but I don't know what stage you're at, Gail. Melanie says, what are your thoughts on Repatha that acts differently to lower cholesterol, aids in return to cholesterol to the liver versus shutting down the cholesterol production? What it's doing is actually changing the LDL receptor, okay? It's actually blocking the receptor so the liver does not continue to remetabolize it. And so they lower LDL. It's almost like, how Melanie, what I think about this is, it's almost like taking from the left pocket and putting it into the right pocket. And I have to be all on board with the fact that all LDL or all cholesterol inside the LDL is bad. And I'm not on board with that. So yes, Repatha, which is a totally different from a statin, you're right. It's a PCSK9 inhibitor. I still have to wonder, why are we so infatuated or obsessed with cholesterol? When are we going to look at particle size, at our metabolic well-being, our insulin, our diabetes? When are we going to start looking? I don't know when. I don't know when the typical doctor, but you have to remember that most doctors are 10 years behind all of the stuff that comes out in what I would say a textbook. So doctors are already behind the 8 ball. So if you have a doctor who's been working for 20 years, they're seeing you knowing 10-year-old data. Nothing unless they are reading every single day. And you guys, I read every single day. I take notes every day, every day to learn and try to share these things with you. I don't know it all. I am scared of how much there is to know, and we are missing the boat. Now, again, we cannot live in a bubble. We cannot live in a bubble and avoid all things. We can't. It's impossible. The fact that you breathe the air and drink water, you could be contaminated with whatever they put in the air and put in the water. Even if you drink filtered water, you're still being contaminated. You're being told things for years and years and years, and it's so indoctrinated into you that if you were to hear like me talk, and then you hear like your doctor talk, or just somebody out in the community talk, you are going to be vying against what I'm saying and what you have been taught. And that is called cognitive dissonance. That They do not gel. My thought and your thought inside do not gel. That's called cognitive dissonance, when there's two different competing ideas and it's competing with what your experience is. So if your experience is all LDL is bad, I don't want to have a heart attack, and I come along and say, hey, all LDL is not bad. Let's look deeper. There are some people who cannot get that through their heads, that there could be something else going on, because the cognitive dissonance is so strong. Their experiences are so strong that they don't like those competing ideas. They do not like those competing ideas. And if I were to try to force my idea onto them, their ideas get actually stronger in their head. So if somebody tells, boy, I'd love you to debate blah, blah, blah. I don't want to debate blah, blah, blah. I've been where blah, blah, blah is. I don't want to go back, but I will listen, because I now have the ability that I don't have to be fighting anymore. I've learned this way, that all LDL is bad. And now I'm learning this way, not all LDL is bad. And why not? And what are the components of having bad LDL, and what are the components of having good LDL? Because if you took all the LDL out of our body, hi, Julie. If we took all of the LDL out of our body, what happens to our immune system? What happens to our brain function? What happens to our heart function? What happens to all of our organ function? And you say, well, these people have been taking them for 20, 30 years and they're fine. Are they fine? Well, they're getting older. They got the normal joint aches and pains. They got the normal depression. I mean, they're getting older. They don't sleep as well. Their energy isn't as good. Now, you're calling that normal aging, and I'm saying, well, what if it was from the medicines and it was a slow decline where your brain function, or your heart function, or your lung function, or your joint function? Nobody's thinking about that, because the doctor said, yeah, you know what? You're getting older. You've lived a good life. You're 80 years old. Well, what if your telomeres in your genes say, our bodies are supposed to live to 120? And you look at yourself and you go, I don't want to live to 120. Well, I guess it depends on who you're living for. If you're living just for yourself, you might not want to live that long. But if you have some higher being like me, like I have God, I want to do whatever I can for him while he has me here. Does that mean taking a whole bunch of crap and aging myself faster? No. That is how I look at my life. Okay? You don't have to look at your life like that. But if you want to know how I look at my life, I just put the least amount of things in my body that cause a problem. Will I put plants in my body over maybe 1 or 2 times a year? And now, after even talking about it, it gets like, Malea, why are you going to be so dumb? Why are you going to eat all that? You haven't eaten oxalates for a year, and you're just going to go and eat the salad bar? No, maybe I need to talk to myself a little bit more and say, that's not a very good idea. What if you have a heart attack when you go home? Well, that's kind of blowing things out of proportion, don't you think? I don't know. I could bet the guy that was eating the sorrel soup said the exact same thing. What's this going to hurt? I didn't even know about oxalates. Well, the thing is, I know about oxalates now. So it would be a condition of ignorosis. Osis means a condition of ignorance by doing something like that. Risking it. That's like playing Russian roulette. And I do not like to bet. I don't want to bet on these things. And I don't like to bet on your life either. Okay? Lucy says, Dr. Gundry recommends a lot of his own products. Got think a bit there, right? Got think a bit. I'm not sure what your question is. Dr. Gundry was recommending vitamin C as a longevity supplement. I'm actually bewildered by this recommendation now. Don't be bewildered, gluten. He is likely talking to the 80% of the population. Okay? Let me clarify. Dr. Gundry is, I'm not defending Dr. Gundry, but here's what I'm speculating is going through his head. He's going to capture the 80% of the population who is eating a standard American diet. And he is right that if people are eating a standard American diet of processed foods, seed oils, and sugar, the vitamin C receptors on the cells are being saturated. So it's going to take more vitamin C to get like whatever we need, which is 15 milligrams or so. Does that make sense, gluten? So don't be bewildered. It's not that he's saying anything out of the ordinary, because if he's talking to people who are sick, which they are, they're metabolically sick. They got high blood pressure, they got high blood sugars, they got large waist size, they got high triglycerides, and they got low HDL, okay? He's talking to the 80%, the average population who is sick. Do they need vitamin C? Likely. Do they need vitamin D? Likely. But they could be filling themselves up with stored vitamin D that's not active, and they're causing even more problems. And maybe Dr. Gundry is looking at their labs. Maybe he's getting a stored vitamin D. Maybe he's getting an active vitamin D. Maybe he's getting a vitamin A level. Maybe he's getting an RBC copper level. Maybe he's getting all of the iron studies: iron, ferritin, transferrin, TIBC, iron saturation. Maybe he's doing all that, but he's just doing a little commercial here and there. And, he's selling his products. He's talking to the 80 percenters. Okay? It's not that he's telling you guys wrong. He's just speaking to the entire population, and he's selling his product to them. Yes, Bible thumper. LDL is what makes brains and testosterone. I agree. It makes our sex hormones. It feeds our brain. Our brain, is it 40%, 50% is DHA and an omega-3? Yeah, LDL is so important. If we want an immune system, we want LDL. That's why sometimes LDL goes up. If you're sick all the time, or you got so much oxidative stress in your body, LDL is naturally going to go up. If copper is low, your LDL is going to go up. There's so many things that Bende is constantly afraid of having a heart attack when I'm by myself. So that means you're not afraid of having a heart attack when you're with somebody, because they can save you, and that is if they know CPR and they called the emergency EMT fast enough. So I think whether or not you are by yourself or you're with somebody, having a heart attack would be a scary thing. Now, why are you scared of having a heart attack? Is there something to be scared of? Are you consuming a lot of plant foods? Do you eat a standard American diet? Do you have a calcified arteries on a calcium scoring test? There's got to be a reason why Ben Day is having a whole bunch of concern or anxiety about having a heart attack. Did somebody in your family die of a heart attack? I mean, these are things that increase our anxiety. Lucy says, just had lamb chops and bacon for breakfast. That sounds really good. Yes, I agree, James, that vitamin C is intentionally beneficial with carbs and sugars as competitors. Great. Yep, would agree. Ooh, any insight on borax? No. I would need to study up on borax. Yeah, I would need to, I know that people take borax for joint aches and pains, maybe a little pinch of the mules every day. The mules are a laundry booster. That's borax. But no, I don't know enough that I could, I couldn't speak to that. Sorry. Healthy diet is always superior to supplements. I would agree. It would take somebody who can look over your labs, look over your diet, and make sure that what you are consuming is in your best interest, right? Okay, thank you. Appreciate that. Melanie, hopefully I answered your question. MCV takes Solgar. I'm guessing that's the brand, right? 3 milligrams of boron daily for hormone health, but don't know if it's healthy. Yeah, I don't know. I don't know enough that I could speak to that. And I don't even know if that dose, the patients who, when I question if they're on boron, I do ask them how much they're taking, and usually they will say it's like they'll reach in and put that in their water. So I don't know what that is for milligrams at all. Okay. Let me see. Am I missing any questions, you guys? So, Hardgrove, I have a question for you. Being a nutritionist, I'm guessing that you are able to go through, I guess my question is, here it is. When you as a nutritionist, do you tell them what to eat, or do you go through the pros and cons of everything like I'm doing right now? Or do you simply map out a diet plan for them and then expect them to eat it? I'm curious. I don't know any nutritionists, so I'm just curious to know how you see, your clients. Melanie says, I agree that cholesterol isn't the bad guy. Wondering what the worst of two evils is, a statin versus Repatha like med for those who need a med. Okay, Melanie, when we talk about a statin and when you talk about Repatha, a PCSK9 inhibitor, we're most likely talking about LDL cholesterol. And both camps say we need to lower LDL in order to prevent heart attacks, okay? Now, if you were to look at the true reason a person should take a statin, the reason a person should take a statin is because it's an anti-inflammatory and it's anti-thrombotic. The two things that lead, I think, to a heart attack, not LDL. So a blood clot and inflammation that leads to a blood clot is the cause of a heart attack in a majority of cases, because it takes forever for plaques to form, years. And we don't get diminished blood flow until the plaque is nearly 70% blocking the artery, okay? So if we're purely looking at lowering LDL, then I would say either one of them would be fine, right? But the true reason to take a statin, if a person has already had a heart attack or they're very, very high risk, that would be for those two reasons, anti-thrombotic and anti-inflammatory. Do PCSK9 inhibitors do that? They will say they do that because by lowering LDL, which is an irritant, they're going to lower inflammation. But is one better than another? I would say if this person has high cholesterol, first, know why they got high cholesterol, okay? Something is going on that they have a large amount of LDLs. And then you should know, are they large buoyant LDLs or are they small dense LDLs? It's not like a one or the other, Melanie, to say, well, take this one, it's better than that one, because both of them are blocking a normal biologic process in your body. And I can't tell you which one is better. But maybe that person would be better off if they're eating a standard American diet, just bump up the fiber. Just bump up fiber. Take Welchol. Welchol might be the safest. Zetia might be safer. So Zetia, Welchol, and fiber might be the safest if you think that LDL cholesterol is your problem. And it might well be, especially if it's small dense LDLs, That's the problem. But why not just stop the small dense LDLs and stop your carbohydrates? Because carbohydrates are what increase your amount of small dense LDLs. Okay? Attagirl says LDL is cholesterol. The LDL particle, so a low density lipoprotein, is a carrier of cholesterol. Okay? So an LDL particle carries cholesterol. And Attagirl is saying LDL is not bad. Okay? If you're carnivore, your LDL might be higher, which is still not alarming. Unless, of course, Attagirl, what if the person is consuming a diet that's carnivore with high amounts of saturated fat, and you, Attagirl, see that they got an advanced lipid test, and the advanced lipid test showed large amounts of small, dense LDLs. What would go through your head, Attagirl? Would you just blow it off and tell them it's not alarming? When you know that a small, dense LDL is an oxidized LDL, and a small, dense LDL is sticky and could increase plaque formation or be involved in the plaque formation, along with attracting a whole bunch of platelets and fibrin and white blood cells and macrophages and all of these things. Attagirl, what if you came upon a person who's eating carnivore and doing all the things right, losing weight, doing the thing, and you get an advanced lipid test and they have large amounts of small dense LDLs? I mean, how do you even put that in your head? Because usually only people who eat carbohydrates get a ton of small dense LDLs. So how do you explain the person who's eating carnivore? Are you going to say, oh, I don't trust you now. I don't think you're actually eating a carnivore diet because you got all these small dense LDLs. And they say, no, I truly am telling you the truth. I'm only eating meat, eggs, butter, sardines, salmon. I'm only eating meat and fish. I eat a little bit of poultry. What are you going to ask them next? What are you going to ask them next? How much saturated fat are they eating? For the most part, carnivores will have a pretty good idea of how much saturated fat they're consuming. They'll say 100 grams or 120 grams. And you know, Doc, to be perfectly honest, don't people who eat carnivores, shouldn't they be losing weight, not gaining weight? Oh, you're gaining weight? And you're on a carnivore diet? Yes, Doc, I'm telling you the truth. I'm on a carnivore diet. It's the only thing I eat. I only eat steak and a little bit of ground beef, some eggs, a lot of butter. Attagirl, that person is a person who cannot tolerate that much saturated fat. You should lower their saturated fat. You should maybe replace it with some monounsaturated fat and get their liver working again, because their liver is bottlenecked with all of the saturated fat. Their LDL goes up, but you look at the LDL particle size and they're small and dense. They're sticking around in the bloodstream because there's nowhere for them to go, because the liver is backed up. Okay? The liver's backed up. It can't accept any more recycling because it's trying to take care of all the saturated fat that you're putting into it. So this is one instance where carnivores and having high LDL can be a problem. And if you didn't look, you're not going to know. Sure, you got a CAC score, but that could take years for it to even show anything. And this person could be eating carnivore, and the next thing you know, they're in the ICU, the CICU. They had a heart attack. And you go, how can that be? Just keep an awareness. Get further testing. If they have high LDL, find out what kind of particle size they have, okay? Hunter-gatherer says, what kind of weight? Is it bone density and muscle? Bone density. What was the question? I'm sorry. What was the question? I must have missed the original question. All right. I don't know if Lucy and RM are still available, but we had some things going on here. Okay. Penny says, if you don't like fish, is there another way of getting good omegas, like omega-3? Yeah, I would eat grass-fed beef. Grass-fed beef, pasture-raised eggs. Yeah, that would be a good way to get enough omega-3. Yeah, atta girl, the person not gaining a lot of weight. I didn't say that. They were gaining weight. So they were getting a little fluff around their stomach area. And they might have gained, 10 pounds instead of losing 10 pounds or staying stable. I mean, most people who are on carnivore, they don't continue to lose weight. They'll find a homeostatic in between where they know what their body weight should be. Okay? And not all people who end up or eating so much saturated fat and end up with a lot of small dense LDLs will gain weight. That was just something to look for. This person was also fatigued, a little, just tired, no energy, didn't really want to go work out, and then thought, which their doctor told them, you're just depressed. Okay, no, there's something going on. It just, atta girl, it's just something to be aware of, okay? It's not everybody. Oh, yeah, that's a good point. Hunter-gatherer says, why people gain weight? Could it be just muscle mass? Absolutely. As long as you are living, breathing, walking, and carrying your groceries, and you're eating a carnivore diet, you could gain weight, muscle weight. If you're eating a bunch of protein, guess what bones are mainly made of? Protein. So your bone density, your bone strength is going up. Your muscle mass is going up. Could that contribute to a weight gain? Yes. However, what I'm saying is maybe this person is gaining more fat, more fluff around their body, okay? I just think it's a good idea when somebody has an extremely high LDL level, get a NMR, nuclear magnetic resonance imaging of their and get their particle size, okay? It's just a dangerous way to proceed if we don't look into something, okay? Yeah, if I'm missing you guys' questions and you want them answered right away, just do a super chat. It helps us both, okay? It'll move yours forward. And there was a question on celiac and I can't find it. What is the question on celiac that you want for me to look at? Sorry about that, YouTubers. I appreciate your restating it if you can. Yes, hunter-gatherer, that's a good point. If a person says they're carnivore and they're eating dairy and they're getting fat, yes, that is another concern. Dairy is very fattening. And so a lot of people react to it by gaining fat weight, because dairy puts a layer of fat underneath the subcutaneous tissue. So it increases our subcutaneous fat. That's a possibility. I guess my main thing was, hunter-gatherer, to the very first question that Atta Girl came up with is she said, carnivores have high LDL and there's nothing to worry about. And I just gave a nuance to that, a caveat to that. Yes, there are many reasons a person could be gaining weight, okay? I don't think that we should leave a high LDL and not look into it. Just saying, okay? Depending on age, could be hormones, especially a female. And I'd recommend a functional medicine doctor for a BHRT, as they are very protective for the heart. As what are very protected for the heart. And depending on the age, could be hormones. Could be hormones as far as, no, atta girl, let me clarify. I am answering your statement that carnivores have high LDLs and we don't have to worry about it. Now, if you want to go into every other nuance, we can. Maybe you'd want to consider a consult, but I was just questioning and clarifying your statement regarding carnivores having LDLs that are elevated and don't worry about it. And I'm telling you, in some instances, you should be worrying about it, okay? So keep that in mind, you guys. Okay. The MCV says, I have a 31 BMI at age 27. Will this affect my autoimmune disease? Yes. Your fat is very inflammatory. Your fat cells are very inflammatory. When they get bigger and bigger and bigger, they can burst open and release cytokines, interleukin, a lot of inflammatory markers, and that is bad for autoimmune and likely the cause of autoimmune. That's a good point, Nano. BMI isn't totally accurate. Are you fit? So a 31 in a very muscular person is definitely skewed because it's, it goes by body weight and height. So a muscle-bound person will have a higher BMI and be, not fat, but this person says that they have a BMI of 31 and they're obese. So I think they're clarifying that it's not just the BMI that tells them, they're actually looking in the mirror and they're saying, I'm obese. Hi, Selena. Thanks for being here. Selena, if you want to tell people about your group, go ahead and put the link in the, let's see. I'm looking for the, not just comments, but questions, okay? Sudeep says low LDL can be more problems than high, with certain caveats, right, Sudeep? I would agree that LDL will go up. It's the injury, yes. To take care of an injury, and LDL will head to the scene of the crime, right? MCV, one of the best things you can do is to analyze your diet and make some changes. I mean, that would be the best thing for you to do. Penny asks, how do you do a super chat? You can only do super chats over on YouTube. So YouTube has super chat, so it's just a way to support the channel. Okay. All right. All right, it looks like I don't see any more questions. I see a lot of comments, but I'm not gonna sit here and just continue to read comments. So if you guys have any questions, otherwise we can call it quits for today. If you are wanting to do consultations, you can email me at IronLadyDoc@AOL.com, AOL.com. It's in the pinned message. If you want labs ordered and your doctor won't order them, there's a few states that I can't order your labs, but otherwise I get a little bit of a discount that you might not get. Yes, you can go to your own website and, you know, you can order your own, but sometimes, and I don't even mind, you can actually compare the prices of what I get you know, if you tell me what you want, and then you can just compare the prices and use whichever one is cheaper, save your money, right? Is the rescue donation PayPal only? No, it is not. You can use your credit card, Melanie. So if you email me and you want some labs checked, just email me, let me know what ones you want, and I can send those over to you via email, like a cart of labs that you can go choose a lab draw station in your zip code. It's pretty self-explanatory. Susan says, how much liver a day? That's a good question. I would say maybe you don't need it every day. I tend to eat about an ounce every day. Some people will eat, you know, a couple ounces 2 or 3 days a week. But I don't think we need like 8 ounces a day or anything like that. I think an ounce or 2 a day or every other day is enough. Julia, I think that you need to see your doctor in regards to your hyperparathyroidism. I'm hoping that you've had MRI and all of that. The MCV says, can the brain be injured via iron overload? Absolutely. Yeah, I mean, that is one of the biggest causes besides oxalates, right? Causing Parkinson's and causing cognitive decline, Alzheimer's. Yeah, iron overload is probably one of the, you know, biggest causes that you're getting iron trapped in the brain. You're getting insulin resistance of the brain. You're getting heavy metals in the brain. You're getting, I mean, there's so many things. I mean, it could be nanoplastics. It could be smoking. It could be drinking alcohol. It could be blue lights, not getting out in the sun. I mean, there's a lot of things, you know, lifestyle wise, but just to say, is it just iron overload? No. Is that one of the causes? Yes. I think, you know, when I check, a majority of people have iron overload. Why? Because 80% of the people are eating a standard American diet, which is processed foods. All processed foods are full of synthetic iron. Okay? Non-heme iron. That's not absorbable. We can't use it very well. Like 3% compared to like 30% of heme iron. So we can get a lot of iron trapping in our tissues, and that oxidizes, it rusts. Is it rusting in our brain? Yes. Our heart? Yes. Our spleen? Yes. All the organs. Our skin? Yes. That's a big one. Look for brown spots on your skin. I am in Iowa. Thanks for being here, Doc. I appreciate that. TX Clark says, does exercise help knees with arthritis? Yes, but there's caveats to that. You want to build up slowly, because I don't know, you know, anything about your medical history. But in general, if you exercise your body, it will lubricate itself for, you know, let's see. Sudeep says, vegetables and oxalate toxication. If you catch the first half hour of this live stream, you'll hear all about my spiel on oxalates. Yeah, Susan, good question. Does fasting help with toxins, release of toxins? It does. So does getting out in the sun. So does sauna. There's a lot of things that we can do. Sweating is very important to release toxins. In fasting, yep, when we fast, mTOR goes down, insulin goes down, autophagy goes up, AMPK goes up. So that promotes autophagy. Autophagy is like maid service for your cells. The maids come in, they clean up the cells, repair the proteins or reuse it or whatever they can do, get rid of the debris, the trash. And yeah, so yes, Susan, fasting is something that you can do for, you know, for release of toxins. Yeah, thanks, Doc. I appreciate that. Thanks for being here. I now work completely online. I was a solo practitioner, and after 27 years and doing insurance and, working for somebody I didn't find ethical, insurance companies or whoever, I thought that I could probably help 3,000 people online in a day versus 10 people in the office. And I think after a certain amount of years, your fixer personality finds that people sometimes that come to the office really don't want to be fixed. But yet they'll still come in. They still want their labs done. And they end up draining people, the doctors, because the doctor could suggest something, and the doctor, is doing it in what they think is the patient's best interest. And the patient is just not on board, but yet they will still, continue to do the things that they want to do. And that's fine. But when I'm online, I seem to only be helping the people who truly want to make a change in their body or change in their life. And I think that they have missed out on a lot of education by their personal doctor, who maybe didn't have time, maybe had a condition of ignorosis, whatever it might be. They weren't being helped to the best of their ability. And they're paying a lot of money for their health care. And they should be getting answers, and I don't think they are. And maybe you find it's different in your practice, I don't know. But, that's what I found. Is there any advice you have for people who get the ick from meat and they are anemic? Are they anemic? I might challenge you on this. I don't think that there is really anemia. Anemia means what you're going to say is low iron. I believe that there is no truly iron deficiency. We have iron overload. We have iron dysregulation. The iron that we have in our body is all in the wrong areas, okay? It's trapped. And there are reasons why it's trapped. And I went over a few of those during this live stream. But this person may not be struggling with anemia. They might be struggling with the placement of their iron. And they're getting an ick factor from meat. Just picture this, and I don't know if this is the reason, okay? But I want you to think through something. If our body senses we have iron overload, okay? Our body senses we have iron overload. Our body is going to tell us ick when it comes to consuming meat. Why? Because meat is full of heme iron and a lot of it, and it's 30% absorbed, okay? Now, what if the iron is in places where it's trapped, like the liver or the brain or the heart or the skin or other organs? Your body knows that you have enough iron. Could it be telling you ick factor? I'm going to just walking through this. Could it be giving you an ick factor and say, don't eat any meat? It's possible. So 1910, I think your friend really needs to get full iron studies and look at it in depth. Might need to get a ceruloplasmin, might need to get an RBC copper level, a vitamin A level, all of these things, and check what is going on, okay? Just simply taking iron, which is synthetic, non-heme iron, is only worsening the problem. It's getting trapped. You're adding more iron to an iron overloaded state. Just like giving insulin to a type 2 diabetic who's hyperinsulinemic, okay? You're very welcome, 1910. I appreciate you too for being here. Thank you, Susan. No, I get it, Susan. I agree. That's probably why, if you got a lot of individual statistics, maybe just doing a consultation would be in your best interest. So email me if you're thinking about that. Yeah, at 1910, it's going to be hard. They have cognitive dissonance, like I talked about before. It's very hard to have competing themes. And she, I don't know what you do for a living, but she sees 1910 as a friend, and nobody, a friend or anybody, is going to take the place of, her doctor. I want to give you a story, and I'll keep it short, but yesterday I took my mom to the VA hospital for her regular appointments, and the appointment began in the lab, and there was another veteran who was in there for the lab, and he goes, "Why am I here?" And the tech says, "Because your doctor ordered labs." And he goes, "Well, what are they for?" And she says, "I don't know what they're for. I'm just the tech and I draw your blood." And he says, What good are you then?" And she looked at him and she didn't say anything. And he goes, "Well, did my doctor check my blood sugar? I want to know, because that's one of the reasons why I'm here, is to have my blood sugar checked." And she goes, "Sir, I don't know." "Well, who can tell me?" And, after this back and forth, and he's sitting right next to us, I said to the tech, is there a CMP on that list?" And she said, "Why, yes, there is." And I said, "Sir, your blood sugar is in that CMP. So your doctor did check it." And he said, "Who are you?" Now, granted, I'm in my Carhartt jacket because it's 0 degrees here. I have my stocking cap on. And he goes, "Who are you?" And he gave me that look. And I said, "I'm just here with my mom." "Are you a veteran?" "My mom is a veteran." "Oh, well, then I don't need to talk to you." That is cognitive dissonance, okay? He first asked, "Are you a nurse?" I said, "No, I'm not." "I don't need to talk to you. I'm not a veteran. I'm not a nurse. I'm not talking to you." Even if I gave him the correct information, it couldn't get into his head. So I will thank her, 1910. Yep. Yeah. My parents both were in the military. Yeah, Susan, I know, bless his heart. He was confused. He felt that his doctor wasn't giving him the information that he needed. And at that point in time, because he was already frustrated, the tech could have easily calmed him down by saying, "Sir, I sense that you are frustrated," and then given him something to do. "Sir, I sense that you have frustration. I wish that I could answer your question, but I don't know. But I would suggest that you call your primary care doctor. I'll draw extra blood, and they can always add on if it's what you're requesting is not on there." That probably would have stifled the whole conversation. And I probably should have not said anything, but everybody in the room was looking at this guy, and I thought if I could just settle him down a little bit, but it didn't work. In fact, it backfired. And so it just told me that, you know what? I wanted to help, but you have to have a boundary. Let it go. Let it go. And from here on out, I will let it go. Lion says, "Detailed labs and a consult with Dr. J is the best money spent." Thank you, Dr. J. You're very welcome, Lion. Thank you for the kudos. I appreciate that. Mrs. Young answered a question from YouTube: "To get over the ick from meat, fast for 24 hours and try to eat then." Good. That's a good idea. Give it a try. I'm so glad I don't have an ick from eating meat. I crave it. I crave it. Which is another thing that kind of goes along with this. You get an ick from eating meat if your body senses you have iron overload. But what if you crave meat? I'm talking females now. During their period, have you ever heard women say, "Oh my gosh, I crave meat when I'm right around my period"? And then my question to them is, do you have heavy periods? Oh gosh, yes. My periods are so heavy. Well, their body could be trying to exit pent up iron. If they're having heavy menses, cramping, menorrhagia, so you're having periods in between, could be the body's sense in a female to try to get rid of blood. And that's because they could be iron overload. And then their body is craving heme iron for their cells because their cells are starving for iron. They can't use non-heme iron. It's not absorbable. So you got one part of the body that's trying to get rid of it, like a guy going and dumping blood and saying, oh my gosh, I feel like 10 pounds lighter. Because they're trying to empty out non-heme iron. That it's not usable, it's not bound to anything. It could be stuck in tissues, and really if it's stuck in tissues and has no ferroportin, can you really get it out even dumping blood? I say no. Even if a guy goes and dumps blood, or a girl has a period, if she's got pent up iron in the liver, in the organs, dumping blood or having a heavy period isn't gonna help. But the body senses, hey, I got iron overload, I gotta dump some. I have no basis for my thinking right now. This is just things that go on in my head and I just wonder about, okay? All right, so don't say I'm telling you like facts. Parasite says, read Confessions of a Medical Heretic by Dr. Robert S. Mendelsohn. I've never heard of that book. What's it about, Parasite? Tell me. Yeah, 1910, Miss Young, 1910 says, oh, that's good advice about the fasting. Beef tastes so good after a fast. That's amazing. Okay. All right. Okay, you guys, I don't see any other questions. So we will call it quits for now. And I will be back, Lord willing, I'll be back on Sunday at 10 a.m. That's tomorrow, so 10 a.m. Central. I am live every Saturday at 9 a.m. Central and every Sunday at 10 a.m. Central. I do reels through the week, so check those out. If you haven't already, like and subscribe, hit the thumbs up, hit the heart. It does help my channel. If you want to support my channel, there is a PayPal link, there's subscriptions, there's all kinds of stuff, okay? To support the channel. If you find that it's good, something that's free is just subscribing. Something that's free is sharing it with somebody who might have, who might need to hear this information. That's totally free for you, okay? All right, you guys, you have a beautiful rest of your Saturday, and we'll talk to you tomorrow. See ya.